Welcome to From Start of Care to Discharge and Everything in Between for RN, PT, OT, Speech and Social Work e-learning course Part 2. Upon completion of this course, you will be able to complete the therapy evaluation and plan of care worksheet, perform the research visit, perform transfer to inpatient care, TIF, perform resumption of care, perform discharge. Let's take a look at completing some forms as a physical therapist. The RN has performed a start of care visit and completed the forms in the start of care packet. There are two forms that you need to complete: the physical therapy evaluation form and the physical therapy plan of care worksheet. The physical therapy evaluation form and the OT, speech, social work form is used to document your assessment. Sections of the form function similar to the start of care form, such as employee time slip. You will notice on this multi-page form that there are no areas to document orders or goals. These are documented on the plan of care worksheet. From the main menu, with the patient already selected, tap the Physical Therapy Evaluation, non-OASIS, in the non-OASIS Assessment Form section. For this example, the employee time slip is already completed except the service stop time and the patient's signature, which are blank and won't be completed until the end of the visit. Most of the form is related to function and testing. You already know how to do those things, so for this course we will look at specific sections that need to be addressed. Here on page 1, you see there's a section for diagnoses. Just as in the Start of Care OASIS, you will add a suggested primary diagnosis but not the ICD-10 code. Moving to page 3, look at the significant past medical history. Here you will document any past history, precautions, and reasons for referral that will impact the patient care. This area is used in the centralized coding process. On page 6, you will find the medical necessity section. There are check boxes to indicate the medical necessity reasons. If you don't find the reason listed, use the other box to type in the information. In the supporting detail field just below, you will want to document your clinical summary of the patient. This will work as it did on the Start of Care assessment and be used by centralized coding. Tap on page 7. This page is used to document modality billing. This page will only be completed if the payer requires modality billing. Check with the office to determine any payers requiring this information. If not required, you must leave this entire page blank. Complete the form as you progress through your visit. When done, capture the stop time and patient signature on page 1 as presented in previous classes. Tap Sign Save this form. Tap Sign Save this form. Now that you've completed the physical therapy evaluation form, you will complete the physical therapy plan of care worksheet. Orders and interventions are documented on page 1. Goals are presented on the following pages. Frequencies are found on the last page of the worksheet. Let's take a look. From the main menu, with the patient already selected, tap the Physical Therapy Plan of Care worksheet in the Non-OASIS Assessment Forms section. The Primary Diagnosis section will be left blank, as centralized coding will take care of this. Next, you see radio buttons for Start of Care orders or new orders. This tells the system if the Plan of Care worksheet should be merged onto the Plan of Care or needs to be sent as a separate order. You can verify this by tapping the Patient Chart link. Look for the Physician Orders section and find the Plan of Care. If it is still in a pending status, the Plan of Care has not been finalized and your orders can be added prior to the completion of the Plan of Care. Close out the Patient Chart. Because the Plan of Care has not been released, the orders and goals documented on this worksheet will be merged with the Plan of Care 45. Tap the Start of Care Orders radio button. Based on your assessment, you will need to complete the Physical Therapy Plan section to establish your orders, making sure to also complete the Diet and Supply section, which are mandatory. At the bottom of the page, begin filling out your goals, starting with the Home Health Aid intervention and goals if applicable. Here, just as on the Start of Care, you will mark appropriate goals to individualize them for the patient and add short-term and/or long-term goals. Tap Save and you will be taken to the next page. Goals continue here, so continue to add additional goals. Move through each page until you reach the last page. Navigate down to the Discharge Planning section. This will be completed just as it was in the Start of Care assessment orders. Tap Add and enter the frequency and duration as approved when you contacted the physician. If your order was included in the referral, which you can tell in the patient profile by reviewing the referral document and the services needed checkboxes at the bottom of the profile, be sure to include the current visit in your frequency. If the order for your evaluation was obtained by the clinician performing the Start of Care assessment, do not include your evaluation visit in your frequency. This allows the orders to remain intact based on when obtained. Enter the frequency of 3 times a week for 3 weeks, and then 2 times a week for 3 weeks. Tap Save to close the Add Frequency box. If you get the Frequency Overlap Visits box, choose Restrict and tap Save. Navigate to the bottom of the form and tap Sign Save this form. You now need to call the clinical manager to report the evaluation visit as well as the approved frequency and duration. You ran the episode analytics report and identified a patient whose episode is ending. A new episode will need to be created. You need to perform the research visit within the 5-day window. Only the primary discipline creates the new episode. There is a packet to do this, which we will look at shortly. If, however, you are not performing the recertification visit as the primary discipline, you will go a different route. There is an additional discipline recert packet for you to use. It contains a clinical note, summary case conference report follow-up, and plan of care worksheet. Let's glance at this now. With the patient already selected, move to the packet section of My Forms. Move down to Additional Discipline Recertification. Click to open the packet and view contents. The clinical visit note is a reassessment visit note, since you are not doing the research visit, but you are reassessing the patient. The plan of care worksheet in the packet establishes your interventions, goals, and frequencies for the next certification period. And the summary case conference report follow-up gives a summary of your discipline's care. The primary discipline will use this information for a comprehensive review that is sent to the physician. Close the packet. Now let's go back to the primary discipline research and let's see how this is done. From the main menu with the patient already selected, tap the PT Oasis Research in the Packet section. You want to create a new episode. Tap the Oasis Follow-Up Assessment Physical Therapy link. The Oasis Follow-Up Assessment form functions the same as the Start of Care form. Tap page 2. The Oasis questions are found on pages 2 through 12. Tap page 13. Interventions and goals are found on pages 13 through 16. Tap on page 16. CMS requires the physician estimate how much longer the patient will need to receive skilled services. This information will be obtained during the communication with the physician's office and documented in the Discharge Summary section of the Oasis. Use the calendar drop-down to indicate the estimated discharge date. Complete the form as you complete your recertification visit. Use Validate and Export to SHP as mentioned in previous classes. Then tap Send to Office and tap OK to apply your electronic signature. Notice that the new episode that you created is shown here and the Oasis is in the Sent to Office status. Warning: if the form is not completed and is shown as pending, tap the packet. Tap on the pending form, not the blank form. Each time you open a blank follow-up assessment form, a new certification period is created. Let's turn our attention to another form in the packet. This is the medication profile. Just as in the start of care process, a medication profile will need to be created for this episode and the old one closed out. This is an easy process, so let's take a look. You see two medication profiles showing here. On the bottom is the pending medication profile. This is the profile that is currently in use. It has all the medications and discontinued medications and reviews that have been done in the current certification period. The top medication profile is the profile that will be active in the new certification period. Let's open the current medication profile. Tap Medication Profile. The current medications display with medications that are discontinued highlighted in blue. Review the form to ensure it is up to date. Close out the form. Tap the medication profile link in the newly created Research episode. Here you see only the current medications. Any discontinued medications are now removed. Discontinued medications can still be viewed by tapping the View Discharge Medications link. Tap the View Discharge Medications link. Note that the discontinued medication is now shown. You will perform the drug regimen review at this time per your office policy, similar to what was shown on the Start of Care assessment. If all the drug regimen review fields are full, you or the clinical manager can delete items from the columns on the new profile that were documented in the previous episode. These items will be on the medication profile for the previous episode and don't need to be on both. Then tap Sign Save this form. Notice that the medication profile in the current episode is closed, and the medication profile in the new episode is now pending. You will also find the Summary Case Conference form. This form is required to update the physician on the patient condition. After consulting with other members of the care team, complete documentation on the form, then tap Send to Office and OK for electronic signature. Don't forget to call the clinical manager with report of the recertification visit. Return to the main menu. During a patient's care, they may go into the hospital for various reasons. When this happens, a transfer to inpatient facility, TIF, is required to be completed for Medicare and Medicaid patients. With your patient selected, go to the OASIS Forms section of My menu. Tap OASIS TIF/Death at Home Skilled Nurse. On page 1 of the form, check patient ethnicity. Tap Save to move to page 2. At the top of page 2 is the employee time slip. Verify with your branch if this is a pay, or no pay, no bill visit. For our demonstration, no visit was done and we will choose pay only. If no visit was done, only the shift, date, start time, and stop time will be entered. No patient signature is required. Complete the rest of the OASIS questions. Use Validate and export to SHP as previously mentioned. Then tap Send to Office. Tap OK to apply your electronic signature. When the patient comes out of the hospital and is to receive further care, a resumption of care oasis must be completed. With your patient selected, navigate to the OASIS assessment forms on your main menu. Tap the OASIS Resumption of Care Skilled Nursing form to open. On page 1, indicate ethnicity and tap Save. On page 2, complete the employee time slip. Complete the rest of the OASIS as you did on the Start of Care assessment. On page 26, leave the frequency section blank. This will be indicated on the Resumption of Care order form. Enter the service time stop and obtain the patient's signature. Use Validate and export to SHP as previously mentioned, then tap Send to Office. Tap OK to confirm signature. New orders will be needed to resume care for this patient. These are not found in the OASIS itself, but rather in the physician's order section. With your patient selected, go to the Physician Order Forms section. Tap on the Physician's Interim Order, Resumption of Care form. The top of the form will look familiar. You will also need to complete the Post-Inpatient Facility Stay Physician Interim Orders. After documenting physician contact, you will need to create discipline-specific orders. This includes frequency and duration in any comments sections. Tap on Save. On page 2, any additional labs, special procedures/treatment, goals, supplies as indicated. Tap on Send to Office. Select OK to confirm signature. Don't forget to call the clinical manager with report of the resumption of care visit. As we prepare to discharge our patient, we will need to document the care received over the time spent on service. With your patient selected, go to the OASIS Forms section and tap the OASIS Discharge from Agency Skilled Nurse. On page 1, complete M140 and tap Save. At the top of page 2 is the employee time slip. Verify with the branch if this is a pay, no bill visit. If no visit is actually being done, only the date, start time, and stop time will be entered, and no patient signature is required. If it is a scheduled discharge, then complete the rest of the time slip as a routine visit. Complete the rest of the form answering OASIS questions. The outcomes and home compare information will come from these answers. Since we are doing a visit, we will want to put in our service stop time and collect the patient's signature, then tap Save. Use the validated export to SHP links as previously mentioned. Then tap Send to the office. Tap OK to apply your electronic signature. We will want to create a summary of all the care the patient received while on our services. This will include information from the discharge summaries, other clinical services provided as documented on their discipline-only discharge. This final case conference will be sent to the physician and possibly others. We still have the patient selected, so in the My Forms section under Coordination/Summary section, tap on the Transfer Discharge Summary Case Conference Report. This is a one-page report that will summarize all disciplines care of the patient from admission to discharge. In consultation with other disciplines and/or chart review, complete this form to be sent to the physician. Select Discharge Summary. Mark services provided, diagnoses, and those who attended the case conference. Add clinical record review and the summary of patient care. Goals met, yes or no. Reason for discharge. Summary sent to. May select physician or case manager. Is signature required, yes or no? After assuring that all fields are complete, send to the office. Tap OK to confirm signature. When do you complete the modality billing screen? Never, always, when doing a Medicare patient, when told to do so by the office. The correct answer is when told to do so by the office. What color are the discontinued medications on the medication profile? Red, yellow, green, blue. The correct answer is blue. If you are not the primary discipline performing the recertification, you would use a non-OASIS evaluation form, just as in a start of care. True? False? The correct answer is false. The discharge summary is a compilation of all the services provided during care, is necessary only if a private insurance payer, is for office use only, none of the above. The correct answer is a compilation of all the services provided during care. Now that we've walked through the information you need to know from start of care to discharge and everything in between for RN, PT, OT, speech, and social work Part 2, here are some key points you need to remember. A therapy evaluation and plan of care worksheet will be done on admission if the start of care is completed by the nurse. How to create a new medication profile at recertification. Every time you tap the OASIS follow-up assessment link located in the OASIS recertification packet, you create a new episode. Be sure you tap on the OASIS form in the pending status to complete the form. The need for resumption of care orders when the patient has been in the hospital.